Hello, my name is Alicia Aguilard. For my final project for Nursing 302, Business of Healthcare, I will give a presentation outlining healthcare in the United States. The healthcare delivery in the United States is an expansive and complex network of individuals, organizations, and resources that provide medical care to the public. It is composed of a variety of stakeholders, including doctors, nurses, hospitals, medical schools, insurance companies, pharmaceutical companies, employers, government programs, and public health organizations. Each of these stakeholders contributes to healthcare delivery, and understanding the system as a whole is essential to ensuring the highest quality of care for patients. By understanding the system, it is possible to identify areas where improvements can be made and develop strategies to ensure that all members of the system are working together to provide high-quality, patient-centered care. Understanding the system can help inform decisions about the types of care that should be provided, how to best use limited resources, and how to coordinate care between different providers. Finally, understanding the healthcare delivery system is essential for ensuring that the system is equitable and accessible for all members of society. This includes ensuring everyone has access to the care they need, regardless of their economic or social status. Understanding the system makes it possible to identify areas where disparities exist and develop strategies to address them. The healthcare providers in the United States can be broadly categorized into four main types: primary care providers, specialists, hospitals, and other healthcare providers. Primary care physicians, or PCPs, include family physicians, pediatricians, internists, and general practitioners. They provide routine checkups, screenings, preventative care, and treatment for common illnesses. PCPs can create inequities in healthcare access by the availability and distribution of these providers in certain areas or for a specific population, as well as the cost of their services. Specialists are physicians who have received additional training and certification in specific areas of medicine, such as cardiologists, neurologists, and oncologists. Specialists provide care for patients with more complex or chronic health issues. However, they can create inequity because their services can be expensive and they may not be covered by insurance. Specialists may also not be available in certain areas or for specific populations. Other healthcare providers include dentists, nurses, physician's assistant, nurse practitioners, and therapists. These providers offer a variety of healthcare services. Overall, healthcare providers play a critical role in addressing and reducing inequities in healthcare access. We need to increase the availability of providers in underserved areas, provide culturally competent care, and advocate for policies that help expand access to healthcare for all in order to reduce disparities in healthcare. There are many various settings where healthcare is provided to patients. I will address four common settings. Hospitals play an essential role in the nation's healthcare system by providing medical attention to patients who suffer from serious and chronic conditions. Hospitals offer comprehensive medical care, which can range from diagnostic testing to surgical procedures, along with numerous other services. Care received in a hospital setting can either be on an inpatient or outpatient basis. Unfortunately, the majority of hospitals tend to be located in more urban areas, which results in unequal access of care for those who live in rural areas or areas of low socioeconomic status. Additionally, hospital stays have high cost, which can result in higher out-of-pocket expenses for individuals who do not have health care. This furthers disparities in health care. People who require continuous nursing care but do not require hospital services can receive inpatient nursing care, rehabilitation, and health-related personal care at nursing and residential care facilities. Children, the elderly, and those with other limitations in their capacity to care for themselves can receive social and personal care around the clock at these long-term facilities. Unfortunately, the services offered by these facilities come with a high price tag attached to them. Because of this, an individual's access to these services may be restricted if they do not have adequate health care coverage or if they are unable to pay for the cost out of pocket. This results in unequal access to care and higher rates of health care disparity. Community health centers are facilities that provide health care to underserved communities, including people who are uninsured, underinsured, or those living in poverty. These centers help address inequity in healthcare access by providing care to people who may not be able to afford it otherwise. Community health centers may lack the resources to provide the same level of care as other healthcare settings. Additionally, they may be located in areas that are difficult to access for some individuals, such as rural areas. Telemedicine is a rapidly growing system in which healthcare services are provided remotely, usually through video conferencing or other online tools. Telemedicine can help address inequities by offering services to people who live in remote or underserved areas or who may not be able to leave their home due to disability or lack of transportation. However, telemedicine may not be accessible to people who do not have internet access or those who are not comfortable with technology. Healthcare purchasers in the United States include insurance companies, government entities, and individual consumers. Insurance companies are private organizations that offer healthcare coverage in exchange for premiums paid by policyholders. Insurance companies work by providing access to healthcare services through a network of providers. They negotiate rates with providers and reimburse them for services rendered. Insurance companies typically offer a range of different plans with varying levels of coverage and premiums. Through their ability to negotiate rates with providers, insurance companies can help reduce disparities in healthcare access by making it more affordable to policyholders. Unemployed and low-income individuals are not typically able to afford to purchase private insurance. Government entities are public organizations that provide healthcare coverage to eligible individuals. Government entities negotiate reimbursement rates with providers and cover the cost of healthcare services for qualified individuals. As such, they can help reduce disparities in access to healthcare services by providing coverage to those who may not be able to afford it otherwise. Examples include Medicare and Medicaid, which provide coverage for seniors, individuals with disabilities, and low-income individuals. Individual consumers are individuals who purchase healthcare services directly from providers. They are responsible for paying the total cost of services out of pocket. As such, they have less bargaining power than insurance companies and government entities, and often have to pay higher prices for services. This can create disparities in access to care, as those without the financial resources to pay for services out of pocket may not be able to access the care they need. Ultimately, reducing disparities in healthcare access requires a concerted effort from all purchasers of healthcare, as well as from providers, policymakers, and individuals. By ensuring equitable access to healthcare services and addressing the social determinants of health, we can ensure that everyone has access to the care they need.